Hi, my name is Alexis Robinson, and I will be giving a presentation today on diabetes. I will be informing my fellow classmates on what to look for and the types of diabetes that you may have. I just want to start off with just one question. How many of you, my fellow classmates, have diabetes or have a family member with diabetes? It is very common in Americans now to have diabetes. According to the 2013 fact sheet, nearly 26 million of young children and adults have diabetes, and that's about 10% of the U.S. population that suffers from this disease. I would like to first start off to inform you on the types of diabetes that you can have and what diabetes is. Um, Type 1 diabetes um, is, let's see, it's the body's immune system destroys the cells that releases insulin, eventually eliminating insulin production from the body. Without insulin, cells cannot absorb sugar, which then they need to produce the energy. Type 2 diabetes is mostly common in adults. This is called insulin resistance. Type 2 diabetes gets worse, and the pancreas may make less and less insulin. This is called insulin deficiency. Myself, I have type 1 diabetes. I've been suffering with type 1 diabetes since I was 14 years old. My grandma also had it. She was the only other person in my family to have it, and she also died from diabetes back in 2012 due to not taking proper care of her health. So I do know very in-depth information about it because I've been suffering with it for about 10 years. It is a very struggle disease to live with, but if you practice good practices and listen to your doctor, you'll have a very normal life with living with diabetes. The third type of diabetes is gestational diabetes. This only happens when you are pregnant, and this diabetes is when your body cannot produce enough insulin when you get pregnant. It's making too much insulin because you have now not only one um, body to make insulin for, you have two now. And after about 5 to 6 months, your body kind of just gives up on making insulin. And then you have to either inject that insulin inside your body, and that will, or you can have to take pills to let your pancreas know what to do with those glucose in your blood. So those are the three types of diabetes. Is type 1, which is your pancreas does not work and you have to inject insulin. Type 2, your body makes less insulin and you have to take either a pill to make your body know how much insulin to produce. And type gestational diabetes is when you're pregnant, your body gets so weak that it doesn't produce enough insulin for you and baby. Type The differences between type 1 and type 2 diabetes. Type 1 diabetes is more prone in adults. I'm sorry, younger children. It's more prone in younger children, and they usually have to seek help because they're seriously ill from diabetes. Also, they have more frequent low blood sugar since their pancreas does not work, and they may sometimes give more insulin than a normal person should get. It cannot be prevented. Like type 1 diabetes cannot be prevented. If you have type 1 diabetes, that cannot be prevented. Even if most adults that are overweight, that's more probable if you having diabetes. And if you take care of your health, you eat good, you exercise, maintain your weight, you can actually eliminate diabetes or prevent diabetes from occurring. Um, Type 2 diabetes, you don't get very many low blood sugars, and this is mainly diagnosed in adults. People with type 2 diabetes, you'll mostly see adults with this type of diabetes. Um, a couple things to look for when you have diabetes is having high sugar and low blood sugar, and I'm just going to explain some of those things that you can look for when when you are a diabetic, or you know someone that is a diabetic. You want to know what to look for when their blood sugar is high. Frequent urination, vomiting. They are very thirsty. Um, because their body is being attacked by those glucose that they've ate. That sugar is breaking down in their body, which is not giving them any energy. So they urinate to, try to get all those ketones and sugar out their body. They vomit because they're so sick to their stomach and their sugar is so high, they just feel dehydrated. They're very thirsty because they have no energy at all. The sugar has been absorbed in their body that they are thirsty, and they try to get more water to boost up their energy. Having a low blood sugar, you can get blurry vision, you can get very sweaty, fatigue, you get very dizzy, so some of those signs, if you see someone with those signs, you may want to get help immediately because they may have a sign of high blood sugar, which seeks medical attention by a doctor. Low blood sugar can usually, you drink a soda pop and it can boost up your sugar very fast. Some diets that you can utilize when you have diabetes is low carb diet. Low carbs diets when you eat food that's low in carbs like eggs, salad, meat. Any of those foods are low in carbs. They don't break down in the body as fast, and meat actually has no carbs. So if you eat as much protein as you want, you're not going to get any carbs from that. Baked foods is best because it wouldn't eating fried meats can give you higher cholesterol and also high blood pressure and stuff. But meats in general does not affect your blood sugar at all. Another thing is exercising. If you exercise regularly, that can also help you with energy and also help your sugar stay consistently in a stable position. And then the diabetic plate method is basically when you have a plate, which 1/4 of your plate is lean protein, 1/3 of your plate is a salad, and then 2/3 of your plate is the starchy vegetable, which is a high carb with a low carb and a no carb. That's the three categories, which is the diabetic plate method that diabetic can and usually have. Eating no more than 45 to 60 carbs in a meal, which can be very hard sometimes, but if you can stay within 45 to 60 carbs per meal, that will also help you not eating as many carbs per meal, because like I said, when you eat a lot of carbs, that will in turn give your glucose, which is your sugar, and giving your blood sugar to be more if you're not giving yourself the amount of insulin it's supposed to have with eating those carbs. I also wanted just to inform you that another thing that you can utilize with diabetes, just taking your insulin on time with your meals and exercising and eating those low carbs can definitely help you with your diabetes diet. So just generally what we went over is the 3 types of diabetes, which is type 1, type 2, and gestational. The most common people that have diabetes is adults and young Americans. The difference between type 1 and type 2 diabetes is that type 1, your body does not produce insulin, your pancreas does not work. Type 2, your pancreas does work, but it does need kind of like a training, like you have to take medication to let your pancreas know what to do and how much insulin to produce. And then gestational diabetes is when your body cannot produce enough insulin or stops working due to your body working so hard to produce insulin for 2 human beings, you and baby. And then things I went over is the low carb diets that you can utilize. Also, what foods you can eat that's low in carbs, exercising, and also just taking your insulin on time. If you are diabetic, taking that insulin is very crucial and important, and will keep you from getting sick with low sugar or high blood sugar as well. So I hope this information did give you some type of information of what diabetes is, what to look for, and the types of diabetes that you can have. Thank you so much for listening, and I do hope this presentation was productive.